It's one of the most common disorders impacting Canadians' ability to get a good night's rest. Sleep apnea can be a disruptive and difficult disorder affecting breathing while you sleep. Here to tell us everything you need to know about sleep apnea is Andrew Holmes from the Sleep Efficiency Clinic right here in Ottawa. Andrew, good morning to you.
Good morning. Thanks for having me.
It's great to have you on. Let's get right to it. First off, what is sleep apnea?
Sure, yeah. So it's become more and more commonplace to be defined by a textbook definition. It's a cessation of breathing of 10 seconds or longer. What's happening is it's pauses that's happening throughout the course of the night, and they can be happening just a few times on an hourly basis, or they can be happening many times on an hourly basis. And it's muscle tissues in your upper airway that are causing these partial or complete blocks. When you have these blocks in your airway, your oxygen levels go down, your carbon goes up, your brain sends a signal to start breathing again. So what's happening is these respiratory disturbances, if they're frequent enough, they're preventing you from getting to like deeper, more restorative stages of sleep. So you can still be sleeping, but you're not getting to the meat and potatoes. We're not getting to our slow wave sleep, which is responsible for physical restoration, our REM sleep responsible for our cognitive restoration. So it can impact a variety of different functions of the body as well. And of course, the daytime effects can be quite significant.
Andrew, can we unpack a little bit more the symptoms of sleep apnea?
Sure. So one of the most common ones would be loud chronic snoring, for instance. Snoring can be benign, but it can also be a sign of sleep apnea if it's happening on a constant, regular basis. Excessive daytime sleepiness would be another one. People who, no matter how many hours of sleep they get, they just don't feel refreshed in the morning. Morning headaches would be another one. If you wake up in the morning headaches occur because of that oxygen deprivation that's happening when your oxygen levels go down when we're having these apneas. Poor memory and concentration. When we go into our REM sleep, that's responsible for our memory consolidation, so that can be impacting our memory. And of course, if you're waking up multiple times throughout the course of the night, a lot of people think that maybe it's insomnia. Insomnia is defined as the inability to fall asleep and maintain sleep, but the reason for the awakenings could be these respiratory disturbances that keep waking you up throughout the course of the night.
How common is this condition in the Canadian population?
They're saying now that about 25% of the population can potentially be at risk or have already been diagnosed with sleep apnea, 25–26%. So I think we're about 38 million now in Canada. That's about 9 million people who have already been diagnosed or potentially at risk. 1 in 5 adults, they say, are potentially mild apneics. To define apnea, it's between mild, moderate, and severe based on how many respiratory disturbances we have on an hourly basis. So anything between 5 to 15 events per hour would be deemed mild. Anything between 15 to 30 events per hour would be deemed moderate, and anything over 30 events per hour would be deemed severe. But to give you an idea of how severe can be, I've had patients that stop breathing over 100 times an hour. So it's one of those things that we really need to take a look at because it can impact a variety of different areas of our health. Talk
about that. If it's left untreated, how does that impact and affect that individual suffering from this?
Especially as we get older. So when we're in younger years, not so much of a dramatic impact on our health other than the daytime symptoms that we would talk about. As we get older, it increases the risk of heart attack and stroke, congestive heart failure. What's happening when you go to sleep at night and you have these long pauses in your breathing, with these significant oxygen desaturations, it puts your heart under extreme stress. So it's almost like your heart's running a marathon in the evening, increasing that risk of heart attack and stroke. Motor vehicle accidents, obviously there's a decrease in reaction time. Medical errors can happen. There's a link between depression and sleep apnea. Sleep apnea and sleep disorders and mental health kind of have that bidirectional relationship where one can kind of offset the other. And of course, work-related injuries when people aren't paying attention to what they're doing, if they're doing heavy machinery or forklift, and those type of accidents can have obviously a massive impact.
How do we treat it?
So the first step in the process would be the diagnostic portion. Do you have apnea? Is it mild or moderate or severe? Does it need to be investigated? There are ways to do that. The hospital-based approach is kind of the gold standard, although they are plagued with wait times. Wait times can be up to a year for a sleep test. Sleep efficiency, we actually offer home-based sleep testing where patients can do this in the comfort of their own bed around their schedule and routine, and we have about a 1-week wait list for that. So the diagnostic would be the first part, and then after that there are treatments such as CPAP, where you probably have heard of people. Not very sexy, but it is incredibly effective. CPAP stands for continuous positive airway pressure, a mask that goes over your nose and mouth. There are oral appliances, which have made a great impression on the community. kind of draws your bottom jaw forward, less intrusive, less invasive. And of course, there's positional therapy. Weight loss would be another great opportunity to try and reduce the amount of apnea that's occurring, potentially removing it altogether. So there are things that people can be done. Our website, sleepefficiency.ca, has got lots of great tips on there to mitigate those.
Sleepefficiency.ca. Andrew Holmes, sleep expert, thank you so much for coming by.
Thank
Appreciate
you
your help.
Cheers.
Thank you.